So my name is Christina Fresto. I'm the program coordinator of the Health Informatics program here at Confederation College. I was born and raised in Thunder Bay, so I left for school for a little bit, but otherwise I've always been here and don't see that changing. It's one of those cities that you just kind of fall in love with on the drive, even from the airport. I've had students say that, you kind of look around and it's super, super pretty here. And I knew that I wanted to be in the healthcare field, but I wasn't totally sure that I wanted to be frontline nursing. And so that's kind of where health informatics came up. I remember taking statistics classes, and I was one of the probably few in the class that really enjoyed it. And so I think it was a way to blend the two, and that's exactly what health informatics is. Health informatics is it's in the healthcare industry, it's in the healthcare field, but it's looking at how can we use data to leverage and improve the patient experience, workflow. So in with various stakeholders, things, whether it be improving things for the hospital, whether it be improving things for the patients, for visitors, for families, all that sort of thing, for locum physicians that come in and they're working for a month here or something like that. And so it's a really interesting mix, especially for those students that have a healthcare background already. I know a lot of our students come to us with a healthcare background, so maybe they did dentistry, they did nursing, they did biomedicine or biomolecular medicine or engineering or something like that. And so they have a bit of an interest and a background in the healthcare field, but maybe being a practicing dentist isn't really what they hope to do. You can, with this particular industry, let's just use an example of a student who does have a background in dentistry. You can still be inside of and working with dental offices, dentists, dental surgeons, but instead of actually practicing as those, you're kind of helping them improve their practice, their patient experience, and that sort of thing. The current global pandemic has certainly increased the need for this industry. We know that we, as globally, really, not even just in Canada, but across the globe, we kind of had to pivot immediately to offering a lot of things online, right? Yes. And with that, that's sort of where we need these digital health solutions, and that's where health informatics can come in. Is a clinic is looking at coming up with a digital health solution for a logbook for visitors or something like that, and so our students could build those for them by the end of the program, right? You kind of piece together all of the knowledge throughout the eight months, and then by the end, that's what you'd be doing.
Great. So does it mean that the student should really mandatory have the healthcare background, or can the student be from any other area but with the interest in in informatics in general and improving things?
Our prerequisites are three different areas, healthcare being the first one, and students have found that that's the most helpful background to have. But if you're interested in something, in my experience anyways, if someone's interested in something, even if they don't have the background in it, they'll put the time in to learn it. So I have had students with IT backgrounds, and those are very helpful because they know the IT side of things and they're just adding in the health bit. And then the other background that we do take is business. And the reason for our sort of rationale and the advantage that business students have coming into the program is they have a better understanding of workflow, strategic planning, project management, and that sort of thing, budgets. And so when we try and form groups in the program, we try and have them what we call interdisciplinary or interprofessional groups. So inside of a student group, when they're working on a project during the program, we'll have someone from a healthcare background, we'll have someone from a business background, we'll have someone with an IT background, and they all have different backgrounds and they work together. And that's just so that there's sort of multiple lenses that you can look at the same project from, right? So when I mentioned the project too, that's something that's part of the program is a Capstone Project. It's in their last semester. And it's actually a real world project that a community partner, whether it be Provincially, we have one right now with the Ministry of Health, or locally here. So we have a couple with clinics in town. We have one with the health unit. They come to us and say, here's a problem that we're facing, or here's something that we want to know. Help us with it. So students are working in their groups with real data, solving a real problem, and then they're bringing it back to the stakeholder, whether it be the clinic or health unit or ministry, whatever it is.
Is it the third semester? So you have like 3 semesters in this program, or just 2?
Just 2. So it's at the end of their second semester.
Okay, so just 1 year postgraduate program.
Yeah.
Okay.
Yeah. And it's 2, so it runs 12 months a year, so it's 2 consecutive 8 months. It's a full 8-month period, 2 consecutive semesters. There's no time off between, other than a couple week break type thing.
Okay, so what is the typical group? So how many students are in one group?
It depends on the year. I mean, obviously, COVID has changed things for us, but we like to have a class cohort of no more than 30. It just keeps it small enough for us that every student gets the individualized time that they need with all of their instructors. When we're back on campus, we have labs that accommodate up to 50, so we have lots of space with 30 and that sort of thing.
Okay. Can you recall any particular this Capstone project? What was it about? Maybe this year students had something to do with the COVID, something to solve in this area.
Yeah, we actually have 2 projects right now that are based around COVID. And so, I mean, if you think back to any doctor's, any physician visit or any dental appointment or anything like that, as soon as a patient walks through the door, the amount of data that particular clinic is collecting is huge, right? There's so much data. And oftentimes these clinics or these businesses and partners, they don't necessarily have someone on their staff to deal with the data. It just sort of accumulates and sits there. And if they need something, they can probably go in and get it and find it. But there isn't really any analysis happening. It's more just accumulation. So what we've sort of marketed our program as is we can help with that analysis. So one of the things that one of our projects right now is we're looking at the different color coding zones. So I think that's a provincial thing. I'm not sure what they're doing in the Ukraine, but we're assigned a color coded zone based on our COVID numbers.
Yeah, we have it as well.
Okay. And so they assign the zones and they calculate the number, but we don't really have an accurate breakdown of what has happened in each zone. So when we were in the orange zone, let's say, what was transmission like? What were our numbers like? What were the ages that were most commonly infected? What was the acquisition information? Was it close contact? Was it no known exposure? Was it travel? That sort of thing. So this one of the groups of students right now is taking each of the color zones that we were in, say from February 13th to February 24th or whatever it was. We were in, let's say, just an example, let's say we were in orange. What happened in that time while we were in orange? Okay, and then we switched to red and we were in red for 4 weeks. What happened in those 4 weeks while we were in red? So that's one of them that we're doing. The other one that we're doing for a health unit is just a better communication strategy around what's happening with the cases. So the ages, right now they're all populated onto an online database. But the problem is if you don't know how to read a database and you don't know some of the codes that are associated, it doesn't really mean a lot to you. So I have some students working to kind of make that a little bit more user-friendly. So you don't have to have a very high level of health literacy to understand the information, right? It's more appropriate for the general public because obviously this is a problem that's affecting everyone, whether they're health literate or not. So they need to be able to consume the information.
Do students need any special preparation before going to this program? I mean, both technical, like starting from the laptop or any special devices, and also some background, except of the background they have, like in healthcare or in business, maybe something else?
What I found anyways, is if the students have the interest and the motivation, they'll do just fine. The way that we've structured the course schedule, there are building blocks. So there's a couple of foundational courses, there's sort of smaller step courses leading into preparing them for the second semester courses and for them to be able to complete a capstone project. So there isn't, one specific course that's kind of the key course that, if you have this beforehand, you're set. If you have the interest, you have the motivation, what I found is students then have the drive to learn the new things, to apply new things. One thing that students have mentioned is very helpful is an anatomy and physiology course.
Mm-hmm.
And that's just so that, when you're looking at a database, let's say from a clinic, and if you see things like lumbar, that that's lower back. That being said, there are information sort of question and answer sessions every time a student group is given a data set. Myself or someone from the organization will meet with them and go over any acronyms that are used or anything like that.
Okay.
But the students that do have a knowledge of healthcare and particularly an anatomy physiology course have found it much more simple. Hello to all of you in the Ukraine, and I've been there once and it is absolutely beautiful. And I look forward to being able to travel again. And I really hope that we do end up with students in our program from the Ukraine. It's really neat to be able to chat with students about how the healthcare system functions there, right, in their home country. What are the differences? And I think we have lots to learn from each other. The Canadian healthcare system has lots to learn from Ukraine, and Ukraine can learn things from the way we're doing things here. And so my dream of the program is to have students from all over the world in one cohort so that we can all sort of learn together and have almost like a global health informatics education.
Thank you so much for your time. That's it.